Hi, everybody, and welcome to the June Lymphedema Patient Roundtable, hosted by Lymphopress. My name is Alexa. I'm the Marketing and Communications Associate here at Lymphopress, as well as a primary lymphedema patient myself. You may know me as the Lymphy Life on social media. We are so pumped you're here with us tonight. We got a lot to talk about. It is not one, but two awareness months this month in June, Wound Care Awareness Month and Lipedema Awareness Month. So we've got a ton to talk about. So while we wait for everybody to log on and tell us where you're from in the chat, I'm going to introduce our panel here tonight. So we have Kelly Bell, our veteran fighting lymphedema and an incredible advocate for the cause. He's also our, I wouldn't want to say armchair researcher, because you kind of, you are like a armchair lymphatics expert, perhaps we could say.
I'm just trying to figure this out.
Exactly. And we're so grateful you share what you find with us. We have our lovely Angela Jones in Arizona today. She is a lipolymphedema patient and health coach. We've got Karen Rosenberg, cancer survivor, secondary lymphedema patient advocate, and math teacher. So as I love to say, any math questions can go to Karen. And
But wait a minute, it's the last week of school, so I get the next 3 months off.
so you're on summer break.
Yes.
Okay. So no math questions for Karen for the rest of the summer. But if you have fibrosis questions, we have Karen Ashforth, the queen of fibrosis, a certified lymphedema therapist. We're so happy she's here with us tonight as well. Now, we have a Q&A box where you can put any questions, but we like to be mindful of the fact that we cannot give you specific medical advice. Your doctor or lymphedema therapist are the best ones for that, but we can speak from experience or speak generally. And we're just going to get started. We love seeing everybody chiming in chat. We've got Diane from Canada. We've got Layla from South Jersey. And another Leela from Venice, Florida, Tina from Minnesota, so many familiar names. We don't know all your faces, but we're so happy to see you all chiming in. Ooh, we've got someone, Martina from Argentina. That's really awesome. Hi, everybody. Okay, we're gonna jump right into things. Now, wound care awareness. Wounds are something that can be concurrent with lymphedema a lot of times. I'm sure a lot of people in attendance might have had experience with wounds and having to deal with those. And maybe some people on the panel have had experience with wounds. Angela, I know you shared before that you've had experience with wounds after surgery. Is that right? If you'd like to kick us off with sharing your experience with that.
I did. I had surgery in 2019. Had a rather extensive surgery. I had several things done at once. I had a tummy tuck, a paniculectomy, muscle tightening, and a hernia repair. And about a week later, I got really, really sick, and I ended up septic and in the hospital. And my surgical area had to be opened and just left open. And I eventually got a wound vac on it, and it took quite some time to heal. But I would say that the healing for me was uneventful in that I didn't have any complications within the healing of the complication. I went to a wound care clinic, which is a wonderful place to go to, especially if you have an existing condition. It's a wonderful place to go to and let professionals help you and assist you in taking care of your wounds. But also I had a wound vac. So I did not know at the time that I had my surgery that I had lipedema. And that really was not discovered until I was recovering. So it was my wound care doctor seemed to think that made it a little more difficult to heal. But I did eventually heal. It was just something I needed to take. They had me to take extra vitamins and, to keep my circulation going, moving around, staying hydrated. So I would say if you have a wound and it's a wound that you've attempted to care for, you may need to see a wound care specialist if it's something that you've not been able to manage on your own.
For sharing your story with that. I know that one of the ways you can help manage wounds or promote wound healing is actually with pneumatic compression. And I see some nodding here with Karen and Angela. And Karen, would you be able to speak a little bit to that from a therapist perspective?
Absolutely. it's very evidence-based that pneumatic compression accelerates wound healing, that it decreases risk of infection, that it decreases risk of hospitalizations. And I really find that if I have patients with chronic wounds who are not using pneumatic compression, once we get them going with pneumatic compression, not only do their wounds heal up, but they don't get recurrences of wounds. So I think that, you know, there are some people that just because of comorbidities, circulation, whatever, are prone towards wounds. And those are people who should really be checking out pneumatic compression.
I didn't have the opportunity to use pneumatic compression with my wound healing. I did have a wound vac, but I didn't start the compression until afterwards, once my diagnosis of secondary lymphedema and lipedema. Once those diagnoses were made, then I started compression, but the wound had actually closed by that time.
And you bring up a good point, Angela, because there's different lengths of time that people should wait after surgery before starting pneumatic compression. I know that with some of the liposuction surgeons, one of them in Europe has people pumping the very next day because the cannula scars are so tiny. But other patients that have more extensive surgery may need to wait a little longer for the edges of the wounds to close up and for a scar to start to form. And that, again, really depends on the doctor. But I find that it can be anywhere from 2 to 3 to 4 weeks, sometimes even 6 weeks, depending upon the surgery. So if you have pneumatic compression already, then you're really in a good place to have surgery, because you can really help to manage swelling before the surgery. And that really helps with the wound healing itself. And then with your doctor's permission, starting to use pneumatic compression at an appropriate interval after surgery will be very, very helpful.
And Karen, could you, we got a question in chat from Anita who asked, what is pneumatic compression? You're in the right place, Anita, for that question. Karen, I'll lean on you for the more clinical answer, but for us lay patients, pneumatic compression, you may know of them as a lymphedema pump or compression pump. They're basically a device that you attach inflatable garments to that inflate in a sequential sequence to kind of mimic manual lymphatic drainage in a way and help move lymph. That's my very layperson explanation. Karen, you might have a more technical explanation if you could.
You did great, Alexa.
I did great.
Yeah.
Well, I hope so, because I work
Basically,
for LymphoPress, so
I would just add that the appliances also deflate. And
Yes.
so they're filling with air and then they're deflating. And then the net result is that the body is getting this lovely massage. It's very helpful for moving swelling from parts of the body that are swollen into more intact areas. And then it's also, I'm here to tell you that if you have scar tissue, if you have hard tissue fibrosis, pneumatic compression is one of the most powerful things that you can do to help that.
Thanks for clarifying. Tina in the chat says, as far as wounds, she says, I dislike the sores. Mine start out like a cone shape and then a little pus head develops. They are so weird. Yes. And Katie Taylor has a Q&A in the Q&A box asking, what is a wound vac? How can we avoid wounds? Any other tips for healing besides pneumatic compression? Anyone on the panel want to tackle this one?
Angela, you want to describe your wound vac, or Catherine?
Oh, I'll go for wound vacs and something else, because I've had them as well. Wound vacs are basically, it's a negative pressure that helps to close wounds. But sometimes it's very dependent on the location of the wound. So I had one that they wanted to put a wound vac in the inguinal area, which is the area between your abdomen and your upper thigh, by your hip area. And that it does not work very successfully with, because of the constant flexibility of moving your legs up and down when you get up, when you lay down. So it would constantly turn off an alarm and beep at me. So they had to take that out, unfortunately, on me when I one due to that, and had to do what we'll call secondary healing, where it's not closed on its own. It has to close all by itself, and it takes a long time to do that. So when I had to have that done, we actually used what was called Medihoney to help keep the wound moisturized, as well as it actually had medical aspects to it in order to help heal it quicker. And it actually did elevate the bedding of the wound fairly quickly, and it kept it from tunneling, which was really pretty awesome.
Barbara actually asked a question in chat about asking the panel's opinion on Medhoney. So it's great you brought that up. Does anybody
I
else?
didn't even see that. It is one of my favorite go-tos for wounds, because I have a severe adhesive allergy. So you can only imagine a wound vac and somebody with an adhesive allergy, it not necessarily playing very nice. Karen, I'm just looking at your facial expressions, they're priceless. Because the wound vac is put in and it's adhered to your skin with these very special tape, and it is super, super sticky. So I didn't respond super well to that. So we had to move to alternative methods.
And Nina wants to know, what is medicine honey? And I would like to know that too, because I'm picturing just honey from a jar with.
So cool. But here's the funny thing. I ran out of the Medihoney, and the doctor I was actually seeing at the wound facility actually said to me, if you have honey in the bear for right now, that will work temporarily until you can get more of the Medihoney. It actually is more of a gel based, and it's like an alginate. So you can either cut it into pieces, or it comes in a tube that you can squeeze, but you can't put tons on, because if you put tons on, as it sits there on the wound, it actually melts, and it will melt everywhere, and it gets very sticky. So it is definitely something that I never thought would work. But when I saw the drastic improvements in such a short period of time, it was my go-to, that I always keep it in my medicine cabinet, just in case I ever need it.
The honey that was used on me was Manuka honey, which has several healing properties in that honey. And it's also a very expensive honey that you can buy, like Catherine said, just to keep in your cabinet. But wound care clinics do tend to use that.
So it does facilitate healing. It has antibiotic properties also. Just a word about antibiotic ointments, since we're talking about wound healing, because I always tell my lymphedema patients, if you get a scratch or scrape, just put a little bit of preventative antibiotic ointment on that wound and a Band-Aid, and you should be fine. But I want to clarify that there are 3 different types of antibiotic ointment out there. There's bacitracin, which is just one antibiotic. Then there's something called double antibiotic ointment. And then there's the one that's most common that everyone knows about, Neosporin, which is a triple antibiotic. And I've been told by more than one dermatologist that the triple antibiotic can cause dermatitis in some people. So I always encourage my lymphedema patients, it's harder to find because it's triple antibiotic everywhere, but if you look real carefully, you can usually find either bacitracin or the double antibiotic ointment at your drugstore. So that would be my recommendation to avoid skin irritation.
And someone, Sandy Darley, asked, is it prescription? And I'm not sure what you're referring to, but maybe the discussion from the Medihoney, is that prescription?
You can get that actually right from Amazon.
You can get it from Whole Foods or any health food store usually.
Even the Manuka honey, you can order it online. I keep it in the house just because I've heard so many people have success on it, and I have not had a serious infection. I've had cellulitis once, and it was from working in the yard and getting a cut on my leg. And after that, anytime I get a cut, I use Medihoney immediately when I come in.
Sandy says that Costco sells Manuka honey. Well, that's good. And then you can all stock up on a giant jar of it, Costco size. Go ahead, Catherine.
So to tap off of what Karen was just talking about in terms of the antibiotic ointments, something else that I use if I can't find antibiotic ointment is I use a barrier cream, because a barrier cream will also help to protect a scratch. I actually have a scratch on my foot right now, and we're actually protecting it with a barrier cream just to make sure it doesn't do anything to like cause the skin to actually break open.
That's really good to know. I actually, a week or two ago, I had a case of Lymphoria and I didn't have any ointments handy to clean it. I just used soap and water and then dried it and bandaged it up. But I'm definitely going to stock up on some of these after hearing about it. Someone asked, Lena asked in the chat, what causes the wounds? I haven't had any, but would like to prevent that at all costs.
Anything, gardening, pets, bumping into stuff. I mean, you name it.
Yeah.
Earlier someone asked, and I want to go back to, because she asked kind of early. She asked about, she's getting ready to have surgery, I think,
Oh, yeah.
of replacements, and she asked preventative. And when Catherine had her surgery, we learned something after she had hers, because she's had cellulitis. I cannot tell you how many freaking times.
57 times.
Okay. And so one thing when she told me that, I started doing some research, and like, well, I kind of heard, I've seen people on Facebook ask like, can you get an infection from like MLD or something like that? So I kind of was curious about this. And there's research that shows that that if you've had cellulitis in the past, your lymphatics could encapsulate it. And we're thinking, because of what happened with Catherine, that they open that up. And so this is where I'm going to go down to you, Karen, and say, what do you think? And what's the idea of prophylactic antibiotics prior to surgeries if you have lymphedema?
You know, I have not heard of that as standard of care. I know that a lot of people do antibiotics if they have heart conditions before dental work. And I'm sure there's cases where it's important. I believe that with a lot of surgeries, they give antibiotics post-surgery, you know, without anyone even knowing it. I think it's just part of the IV. So I think depending upon the person, the medical problems and history and what the surgery is, I think antibiotics may be used in different forms for sure.
Yeah. Definitely something, if whoever asked that question, I definitely would talk to your doctor or surgeon about it prior to, and just have that conversation, because these are things we're just now like talking about, I think, to try to narrow down.
I want to chime in on this. So I had some surgery, obviously. I've had many. And I'm actually scheduled for one for next week. And due to the amount of cellulitis battles I've had, and many of them actually being the MRSA infection, I've actually seen an infectious disease specialist, and their recommendation, because I'm actually considered to be an MRSA carrier, is that I have to be prophylactically given an antibiotic before they even puncture my skin. And they have to be very cautious that they can't give me a weak antibiotic that will help protect against MRSA, because of the amount of times and how often I've had MRSA. So you have to like make sure you really explain the full medical history to whoever is doing the surgery, so that this way they can make the best possible determination on what is best for you. So I actually, with me having surgery next week, had a consult back in March with the infectious disease doctor, and they gave me the very specific recommendations, which the surgeon actually is going to be following exactly to a T, he said to me last week.
Please.
I want to just mention one other little facet, since we're riffing on infections. And there is a correlation between gluten intolerance and primary lymphedema and infections. And I have done the gluten challenge with many of my patients who seem to have monthly infections. They just keep coming back. And we've stopped people from having continuous infections. And these are people that maybe don't even have wounds. Another thing is that if someone has a lot of, a long history of infection, it's good if it's possible to culture that infection, because it may not be treated correctly. It may have been treated with the wrong medicine, and sometimes it can even take a combination of medications. So that's where finding an infectious disease specialist is really helpful for people in that boat. And my heart goes out to you, Catherine. You're a real zebra here. My goodness.
Kelly will tell you that I literally have my infectious disease doctor's personal phone number in my back pocket. So when needed, it's a, hey, I'm going to text you and ask you what to do kind of situation. And he responds very quickly.
I keep telling her, she keeps proving every bit of research I find. And I'm like, what are you like? You could spread that out.
I would love to. I'm
Overachiever.
tired of doing that, but my body just says, no, I want to prove research.
Well, Fenton had a great reminder in the chat. He said, be careful when clipping toenails or pedicure. Keep toes clean, dry, and medical grade skincare lotions after bathing are helpful. Clean feet are happy feet. Same goes for upper extremity lymphedema patients, respectively. That is a really awesome reminder, Fenton. Thank you.
Can I tap into that?
Yeah.
So in terms of clipping toenails, a lot of people don't realize that you can actually go to a podiatrist and actually have your toenails clipped for them covered by insurance due to the diagnosis of lymphedema. And the insurance companies, a lot of them will actually cover it every 6 to 8 weeks without any say. I used to never do that. And then I actually wound up with a cuticle on my big toe that caused a cellulitis infection that didn't go away for quite some time. So I learned my lesson the hard way in terms of I will now see a podiatrist on a regular basis.
That's such an interesting fact. Medical pedicure, basically.
Yeah, basically, and then I go to the nail salon and have them paint the toes after I'm done, but they're not allowed to touch.
Yeah.
No touch.
That's a good point. Yeah, if you go in for pedicures or manicures, if you have upper extremity, it is good to let them know not to touch or clip like that. Willie says, clean feet smell better too. And you are so right, Willie. We have been getting tons and tons of questions, and I hope we can get to all of them. I'm going to switch gears a little bit. We have a question about lymphedema. Oh, first, Marcia says she's going to her first medical pedi tomorrow. That's exciting. Well, you have to tell us about it next month. Layla in the Q&A box is asking, when using pneumatic compression pants, so I'm assuming like a lympha pants garment situation, how many times per day is too much? And can compression garments for pneumatic compression be used safely for longer than 1 hour per day? Throwing it over to Karen.
So ultimately, it's up to your doctor, because the doctor is prescribing the use of the LymphoPress. It's a medical device. And I think that there's flexibility in terms of the amount of time. I know that way years ago, 30 years ago, they were doing what's called pump downs in hospitals, where people would be hooked up to catheters and they would be using pneumatic compression for hours and hours at a time. And so I think that the side effects of staying in a pump for a long time, for longer than 60 to 90 minutes, might be stiffness. The body might want to move around a little bit. And frankly, my opinion is I think that if someone has a good reason, let's say that they've come back from a flight to a tropical country and they're swollen like crazy, being in the pump for an extra hour, 2 hours total, is not a huge problem. I think your bladder is going to stop you before, anything else. But I also want to say that I think that pneumatic compression is excellent, but if you're needing to be in a pump for longer than an hour, then I would ask, what is your compression program? Because ideally, after you're in the pump, you should be getting into compression that maintains the reduction. And so I would encourage people to go to your lymphedema therapist to make sure that you're in the right kind of compression garments. Maybe you need another reduction round. And then it's summertime. Getting in the swimming pool is probably, okay, I'm going to say it. I think it's better than Lymphopress because you're getting exercise while you're getting full body water compression. So I can't get all my patients to go in the pool, but it's, I think, a very healthy, wonderful thing as long as you're protecting yourself from scratchy bottoms of the pool and sun and fungal infections in the locker room. I mean, there are some definite risks, but I am a huge advocate for aquatic therapy. So anyway, that's a roundabout way of answering your question. Yes, you can safely pump for more than 60 to 90 minutes. It should be something you run by your doctor, and yeah.
Thank you for that. And it is the perfect time of year now. We all lymphedema patients, if you have access to water, should all be in it because it's going to be hot and we're going to be sad because it's going to be so hot and miserable. But one of the things that has come up a lot whenever we talk about dealing with the heat is putting your compression garments in the fridge or freezer for a little bit, get them nice and chilled, and then wearing them. And that's a really great lymphedema hack. I have not tried it myself personally, but I know Catherine is a big advocate.
I just took one out of the refrigerator and put it on my leg.
Oh my
before I
God.
signed on.
That is awesome. And you've put your night garments in there too, because I know.
That's what I just took out. Yeah.
Oh, you did? Okay. I'm gonna have to try that because I end up taking I have a Solaris tribute night garment at night, and it's so helpful, but it's so hot. And that sounds like a really nice pre-bedtime ritual, is putting my garment on ice, so to speak, and then wearing it overnight. So I keep it on, but that's always a great tip. Sandy says swimming in compression garments is heavenly. Yes. And you don't even have to wear garments in the pool because what Karen said, it has natural compression. But if you have an old garment lying around in your rotation, and I always wear old garments in the pool, it's helpful. Martina asks in the Q&A box, and I'm going to grab this one because I go to a lot of concerts. She says, I'm going to a concert in August. Any tips to take care before and after standing for a couple of hours? I have a Lymphopress pump, so I like to pump either before or after, or both if I can, just to prep my leg and give it some TLC. But a lot of concerts too, I mean, if you can find some sitting area, like scope out some spots where if they have seats kind of to the side or a safe place, you can sort of lean against something too, is helpful. And comfortable shoes. Comfortable shoes are key if you're standing for long periods. But if you're going to be dancing, that's good to get your lymph moving. So at least you'll be compensating in that way. Let's see. Anyone else in the panel have any tips for events in general, standing for long periods? And what if you don't have access to seating or something like that when you're at an event? What do you guys do?
You could potentially find a place to lean up against. So this way you're not putting full pressure on that limb if it's on the lower extremity. You can also make sure that you potentially get an extra appointment with your CLT if you're currently seeing your CLT, to have that happen that day, close to the time that you're going to be going or preparing to go. And, potentially talk to your CLT about other compression options if potentially your regular daytime garment may not work as effectively when you're on your leg or limb for a long period of time, such as using a Velcro wrap, which is adjustable and can be adjusted as the limb is changing while you're standing on that particular body part.
Yeah, and Sandy in the chat, she says about concerts, she says, if I stop dancing, I'm great. It's when I stop dancing and just stand, it is torture. I take a portable wheelchair if I need to sit. That's a really good idea. Thank you for sharing that.
Yeah, I'm with her. Like, that's the issue I have. I have to keep moving whatever I'm doing. If
Mhm.
I have a project that I'm working on, that's one thing that people don't like, because like they want to pause and take a break, and I'm like, no, because me getting going again, because I started swelling in between the pause. So because while your fluid, your vascular system's going and lymphatics are going, and to stop that for me is like jump starting a train, and it never works well.
Yeah.
So yeah, just keep dancing. That's what you got to do. Go to
Just
clubs with have lots of dancing.
never stop dancing. Okay, let's see. Tina says about the night garments. She said, now if we can solve the problem of hot flashes and hot garments. Yeah. Just put everything on. Just have a bed of ice cubes and that'll help. Okay, we're getting tons of questions in the Q&A box as well. Well, first Sandy says, I cannot stand standing. Yeah, unfortunately, we have to do it sometimes. Willie Strength asks in the Q&A box, my wraps do not maintain the effect of the lymphopress. Should I have tighter wraps? This is definitely a good question for your lymphedema therapist or doctor to reassess your treatment. Anyone on the panel have suggestions about how to have that conversation with your therapist, maybe advocating for yourself and your needs?
I guess I would wonder if you're in the right compression garment, but compression garments don't work the same as pumps do.
Mhm.
And so when you're moving around, you're going to get muscle contraction against the compression, and that's going to help move fluid. If you're not moving, then that could be a problem too. So I totally agree with Alexa. Have a conversation with your lymphedema therapist and see what you can do to kind of revamp your program.
Okay, let's pivot because it's also Lipedema Awareness Month. Let's pivot to talking about lipedema because frequently a lot of patients with lipedema often have lymphedema as well because it causes issues with their lymphatic systems. We do have our very own lipolymphedema patient on the panel, Angela Jones. If you are willing to speak a little bit about your experience managing both and what that's like for you, and do you find that when one acts up, the other acts up as well? I mean, I'd imagine they're kind of connected, obviously, but would you like to share?
It actually kind of seems to me like, for me personally, they're always in conflict with each other. I'm in Arizona part of the year, North Carolina part of the year. Here in Arizona, this time of year, or any part of the year, is hot here. And I seem to do really well with the dry heat here. I'm not sure what's benefiting from it. I'm not sure if it's the lipedema or the lymphedema. I also have a sauna, and I've tried that. That doesn't go well. It makes the lipedema angry, I think, or the lymphedema. I'm not really sure which, but the only thing I find that really is the simplest thing for me is to stay moving and to stay hydrated, and to just, I stay away from foods that I know cause me a problem, like inflammation and swelling and that kind of thing. But the main thing is I try to stay consistent in whatever I do every day. I try to move. I try to, like I say, stay hydrated. And I just kind of pay attention to which I think is acting up, because sometimes it's really hard to tell which is complaining. And sometimes you can't treat them both the same. So it's just management. I do what I think is going to work, to be honest.
That's a good way to put it. Do what you think is going to work. That's often what it comes down to. And we talk a lot on the roundtable about the trial and error that is living with lymphedema and lipedema too. It's not the same for everybody. And Angela, you say this all the time, what works for somebody else isn't always going to work for you, you know, and it's unfortunately, you got to try things out and see. But yeah, we're always grateful for that reminder. And like a lot of people say too, Sandy, for example, she just said she's so grateful for all the good info on this platform. And, you know, that's why we're here every month, is there's a lot of people tuning in for the first time and they don't know what's ahead or what to expect. And a lot of us on the panel, we still don't know what's ahead or what to expect with our own lymphedema journeys. I know, Kelly, you are kind of constantly fighting that Sisyphean battle of rolling the boulder up the hill sometimes, of figuring out what's going on with your lymphatics and how to treat it best. And you actually had a really interesting kind of new treatment foray with Eastern medicine. If you want to share a little bit about that with the group, we'd love to hear it.
Yeah, I'm always trying to find, if you can't fix it, then how do you, like, is there any treatment for it? You know, and so, because mine can't be fixed. And so for me, like my thoracic duct and everything's so messed up, I went to a Chinese medicine doctor. And I will be honest with you, like, so when you deal with them, they don't want to necessarily know your diagnosis. They want to know any surgeries you've had, your symptoms, and then they're going to diagnose you from what they've been trained. The person that I'm seeing she actually runs one of the schools in Ohio, and she's from China and was trained by a Chinese master. But what really shocked me was, after reading just my symptoms, she said, well, after you had this surgery, where's your thoracic duct damaged? And I'm like, how did you even get there? Like, you know how many doctors I had to get to before they even got there? And then after meeting with her a few times and she decided what herbs I want to take, when she was explaining to me, she said, like, she said, these are going to help with hopefully your kidney flow, your chi. And she said, and it's not, your lymph doesn't just take away debris and stuff. It really carries a lot of nutrients. So we want to make sure your body gets the nutrients as well. And I'm like, wait a minute. I can honestly, like, most people have no idea the nutrients that's carried by the lymphatic system, but she's focused on that. And that's part of the Chinese medicine. And I'm like, how in the heck? So I'm not quite 2 weeks in. I just started acupuncture. And so I will keep you informed on these symptoms, because my lymphatics my lymphatic damage actually attacks all my organs. My kidneys are not doing well, and they don't have really a solution for that. And so these are things I'm trying, and I'll let you guys know what comes out of this chi, because the whole goal of their chi is to warm my body. Basically, when warming it will actually create more vascular flow, which especially centrally, it creates more lymphatic flow. So that's the goal. So I'll keep you informed, but it was pretty cool having someone that actually was feeding me information that I'm aware of, rather than me trying to teach someone. So it was pretty cool.
That's awesome. And that's a perfect example. You know, sometimes you have to try things that are a little beyond your regular scope or what you think is going to help you. But always do it safely, obviously, and do your research and all of that beforehand too, of course. But
yeah, there's a doctor in the mix, between a Western doctor in the mix with the Chinese doctor. And she, by the way, she corrected me when I went to Eastern medicine. She said I was trained by a Chinese master. And so she's like, so when I say that, I'm not trying to be offensive. So, but there's a handshake, and Cleveland Clinic even has Chinese medicine in their clinic. So if you guys are curious, acupuncture stuff in their clinic. So it's not like way out there. It's just different for my condition. So
nice. Charlotte in the chat just had a really good message. She said, helpful hint for the person earlier in the chat who was wondering about whether they were in the correct garment. Currently, I am doing surveillance checks with my therapist routinely as we are working together to find the right garment for my lower leg edema. I'm on my 4th garment. It is a trial and error and working closely with your therapist. Stay persistent. Very true. I think a lot of us, sorry, I didn't mean to cut you off, Kelly. But real quick, a lot of us, find, even with compression garments, we all have sort of our brands or our styles that we sort of drift to. Like, I'm personally a Medi gal. I love my Medi thigh high and my attached toe caps. I am team attached toe caps for life, but there are some people who are unattached toe caps only. And I get that. So once you find what works for you, like, it's like what they say, when you find a shoe that fits, buy it in every color. When you find a garment that fits and is comfortable and helps you, check with your insurance, but get it, that's what you should stick with if it helps you. But Kelly, go ahead.
I just think that's the most important thing, is to try to find you a therapist that is a partnership, but do you feel comfortable talking things with? Because to me, that's the difference between success and failure, is having either a doctor or a therapist that's working with you, because we're all different. And one of the worst challenges I've ever had, I've seen quite a few therapists over the years with moving, is trying to find one that's like doesn't try to stick you in a trained box, because I'll be honest with you, with as little as we know about lymphatic dysfunction and what it causes, trying to find that therapist, and if you actually bond with, that's willing to work with you.
Yeah,
So.
good point. Kimberly has a good question. Can compression garments make your lymphedema worse? I would say if you have ill-fitting ones, but I'm going to ask Karen to weigh in on how you can tell if a garment is hurting rather than helping you.
There can be a lot of things going on, and I wouldn't try to second guess things. I would try to get with a knowledgeable practitioner. I will tell you that I have seen a number of patients with lympholipedema who also have mast cell, and the mast cell inflammation, if it doesn't get under control, I've seen people just struggle with being able to tolerate compression garments. So I would say that try to rule out whether there's some type of inflammatory condition that's occurring and deal with that. Because the patients that I've had who were able to address the mast cell activation disorder were able to actually not need compression garments once they got through with dealing with the underlying inflammation. So there's lots and lots of different things at play. And, I wish that we could, make this into a clinic and drill down and figure out what's going on, especially with you. But I think if you can find someone who would take the time to work with you on this, that's the best route.
Willie clarified his question from earlier. He says, I asked my question in a way that did not get the answer I was seeking. In most cases, should your wraps maintain the effects of the lymphopress from session to session? I do not have an ongoing therapist, pretty much on my own. Yes, you should have your compression garments or your compression wraps maintain the reduction that you get from your lymphopress. Again, I'll defer to Karen or any of the others on the panel to speak a little more about that, but that should be kind of maintaining that progress in between sessions.
Yeah, and Willie, if you're struggling, you need to get with someone to help you. This is a hard thing to figure out on your own. Mm-hmm. So even if it takes going to, 2 or 3 people before you get the right answers, don't give up. Really, you should be able to manage your swelling.
I'm gonna send you a link, Willie, that has some resources on finding a lymphedema therapist. Actually, I'll put it in the main chat so everybody can see that if they're interested. Right, y'all, you're asking so many questions now, it's hard to keep up. All right, and we are at 8:43. Oh my goodness. Okay, this is a great question from Sue Dunn. What is the difference between lipedema and lymphedema? Anyone want to jump on this?
Karen.
Karen.
Okay. So lipedema is thought to be an inherited condition that is mainly seen in women, where there is abnormal fat that is inflamed and painful generally. And it often causes the body to accumulate fat in particular areas like the hips, the buttocks, sometimes the lower legs, sometimes the upper arms. Whereas lymphedema is chronic swelling. And you can have lipedema, abnormal fat, without having swelling, but you can have them together. And so it's best to go to a doctor to kind of tease all of this out. There's hope for both of them.
Yeah. And I would like, oh, go ahead, Kelly.
Yeah, I just, Karen was on a panel recently and I was watching, they actually showed the difference, or they showed what lipedema fat looks like in Durkin's disease, which is where the fat it gets wrapped into the nerves and the fascia. And those, when you saw the fat, you could tell it's not normal. It doesn't take a rocket scientist. You could just tell. And it was amazing just seeing that. And the doctors on the panel were great. And so if you have it, just so I think I'd share this just so you know, as Willie needs help understanding, we're in a new frontier with lymphedema. So don't give up. There's lots of research coming and going. And so just stay in the world and keep staying connected with these roundtables and things, because things are coming are amazingly coming out.
Yeah, and we actually have a lipedema patient roundtable. I'm going to put the link in the chat. It's actually next Wednesday at 8 p.m. Eastern Standard Time, and it's also held monthly. And that's a really awesome resource just to hear from other lipedema patients about their lived experiences and hearing what works for them and what doesn't work. And it's kind of like this, but with lipedema. And just like our roundtable too, all of the recordings are posted on our website, lymphopress.com, as well as on YouTube. It's the Lipedema channel on YouTube is their channel, and ours is the Lymphedema channel. So we also have a podcast, fun fact, where you can hear audio versions of the roundtables and patient interviews too, if you're just looking to hear what other people's experiences are like. Oh, and yes, Sandy, thank you for the reminder. Dr. Herbst is doing a webinar with Lymphopress tomorrow night at 7 p.m. Eastern Standard Time. So I will put the link to that in the chat as well, and that will also be available on YouTube afterwards.
Can I say too about lipedema? On occasion, the fatty deposits are more nodular and may even be hard under the skin sometime. And lipedema fat is not affected by lowered calories. It's not affected by exercise. Only way that I know, and Karen can correct me if I'm wrong, is to have surgery. It's a particular type of liposuction to get it out, but it's not affected by diet or exercise.
Yeah, it's suction assisted protein lipectomy, I believe, is the liposuction for lipedema treatment. And it's a special one, like Angela said, to treat that. And yeah, you can have pain with both lymphedema and lipedema, but the lipedema pain, from what I understand, is more focused. Is that correct? Like in certain areas, because it's the fatty deposits that are really painful, whereas with lymphedema, it tends to be more of that heaviness that we get, or the pins and needles.
And I want to just echo what Kelly said about research, because just piggybacking on what you said, Angela, Dr. Herbst and I are actually in the process of studying a new treatment using high frequency ultrasound to help to get rid of fat. And I did a pilot feasibility study this winter with 5 of my patients, and we saw an average reduction of 3 centimeters at each thigh after 6 treatments. So this is something on the horizon. I'm going to be in Tucson next winter, and more to be continued.
Awesome. And Fenton just put in the chat, he wants everyone to know that the Lymphedema Treatment Act bill celebration in DC that was held recently went very well, and we all got to meet our senators and representatives who helped support and push our bill into law. And like Sandy Darley mentioned, Medicare garment legislation goes into effect January 2nd, 2024. So that's for those who are asking about coverage for compression garments. There is going to be Medicare coverage for that on the horizon, which is amazing. Kimberly asks, can lymphedema lead or cause lipedema? So no, it can be the reverse. Lipedema can cause lymphedema, but lipedema is an adipose tissue disorder, meaning the fat cells. So that's the short answer on that. And we do have an article, I'll find it and put it in the chat, on the differences between the two. Because they are super similar in the presentation sometimes, but they are different conditions. So let's see. Well, we're getting to the last 10 minutes. I thought we could start doing a new little segment. What are we pumped about this month? So we'll go around the panel and people in the chat too. If you want to share something that you're pumped about this month in regards to your lymphedema or just in general too, but I can start. I'm going to be in July. Well, two things I'm pumped about. I'm going to Camp Watch Me in July, which is the pediatric summer camp for kids with lymphedema and their families. And it's tons of fun. It's been going on a couple years now. Bryland's Feet Foundation, they organize it. And I encourage you to check out their website. I can put that in the chat too, but it's great to see all the little kids with their compression garments running around and just being kids. And then on a personal note, I'm starting a round of CDT, complete decongestive therapy, in July as well, kind of kicking myself for doing that in the hottest months of the year because I'll be bandaged to my knee, but it's worthwhile. So Lena in the chat says she's pumped about receiving her new LymphoPress pump. We love that. Who else on the panel wants to share what they're pumped about?
Well, I'm excited because at our next roundtable, I'm going to be in Santa Cruz by the ocean for the month of July. So I'm really excited about that. I'm going to be taking some time and catching up on reading articles and doing research and, you know, a lot of non-clinical stuff.
That's awesome. Sandy in the chat has concerts this summer, dancing and fun, and Fenton is pumped about this roundtable and all your support. And Lena says, what Fenton said too. Go ahead, Catherine.
So I am super pumped about next Wednesday for me. They're actually going to be doing the staple liposuction surgery on my leg. And when I went back to the surgeon last Tuesday, he said to me that he can actually get my leg down to be the same size as my other one or smaller.
That's amazing.
So, and that hasn't been for 34 years. So this is going to be a life-changing, emotional summer for me once again. But this one is for a good reason, like not a scary reason per se. This is a personal choice one, not a, oh my God, we need to fix me ASAP. Like last summer.
Amazing. Well, we can't wait to hear all about that at next month's roundtable. Kelly, did I see a tentative hand raise?
Oh yeah, I mean, I'm excited to. I mean, you guys know me. I'm always in the research, and so the fact that central lymphatics is actually starting to be like talked about, that's what I'm excited about. It actually has a slot at the NLN conference in October. And so if you want to come there and see some great presentations, and there's going to be 4 people all diagnosed with central lymphatic issues, some help, some can't be helped, me, but we'll all be there to open up what goes on when the central part messes up.
That's awesome.
I'm super pumped about an herbalist class, an herb class that I'm taking to piggyback off what Kelly said about Chinese medicine and herbs. I never had a strong respect for herbs. I kind of saw it as something that was kind of fly by night, not a serious thing. But I'm in my second herb class now. I'm actually taking several classes right now, but this is my favorite class because I'm realizing and admitting that a majority of our pharmaceuticals come from herbs. And so I'm learning a lot about herbs and how different herbs that we can use for different conditions. So I'm super pumped about that.
That's fascinating. We expect a cool write-up and presentation at next roundtable. That's your homework assignment. Karen, oh, you've already shared, Karen. My goodness. Well, we have some more people that are pumped in the chat. One person said they are pumped about getting their last lipolymphedema surgery. That's amazing. Good luck with that. Tina says she agrees with Fenton. She had a mini panic attack yesterday thinking she missed the roundtable. Don't worry, it's Tuesday today. You didn't miss it. MJ says, you all are so amazing. I learn something new every month. We're so glad you're with us every month, MJ. And Yvonne says, I am very thankful about this roundtable. I learned a lot. So we're really glad you did. And we hope everybody is learning and getting stuff out of this. We are here every second Tuesday of the month at 8 p.m. Eastern Standard Time. You can register, even if you aren't able to make it live, we ask you or encourage you to still register because you'll get the email with the replay afterwards. It's usually about a week turnaround once we get it all polished and edited for you all. And we have lots of webinars. We have 2 webinars this month about lipedema. Dr. Herbst is tomorrow, and then next week is the Lipedema Roundtable and a webinar with Linda Ann Kahn called The Issues Are in the Tissues, which should be pretty interesting too. Everything is in our link tree, which I'll stick that in the chat real quick, but it'll also be in our replay email that goes out. So you can register for all our events there. Fenton has a quote for the day for us this month. He says, "When you come to a fork in the road, take it and move forward." Yogi Berra. That is a great one. We're all going to move forward and have lots to share next month. So thank you everybody for being here. We're ending 5 minutes early. I'm sorry. I didn't realize we had 5 minutes left. Does anybody have anything to fill the last couple minutes before we close out?
I'll just say this, and I think I'm hearing Willie's kind of desperation in his voice. And Willie, I've been battling this for 18 years, and all I can tell you is find your peace and just hang on. I've seen some amazing things, like through years of stagnation, nothing, and then things are changing pretty great. So if anybody on this panel is wondering, like in desperation, just hang on, like, and things are coming. So I just don't want anybody to give up. And so that's why I say find your peace and find your calm in this rough water, because it can be overwhelming sometimes, but that's why we do these tables, to let you guys know we've all have been there and are doing it. We haven't done it. We have to continue to do it.
Yeah, that's a really good point. It's all ups and downs, but you're not alone for those ups and downs, which is the important thing to remember. So we're here every month, like we said, but there's lots of communities on social media too. There's a lot of Facebook groups. There's a lot going on Instagram. You're not alone. So we're so glad you came here tonight and asked questions and sought more information, because that's the first step too. Just asking questions is hard. And that's one of, it sometimes feels like an insurmountable thing to be faced with a chronic condition like lymphedema, but it's a day by day thing. And yeah, Fenton just said, day by day, look for the small victories. So
I just want to make a quick clarification on somebody's comment that was in the chat. I guess I'm gonna hope I pronounce this right. I think it's Ann Webster. She has commented that the surgery is for lipedema, not lymphedema, and that is incorrect. I am not a lipedema patient. I am actually a secondary lymphedema patient only. There are surgical options for both. You just have to make sure that you're seeing a doctor for the right type of surgery and the right surgeon for that particular surgery for the condition that you personally have.
a very good point. Thanks, Catherine, for clarifying that. And Anita says, I'm happy that the disease has been discovered. They will be working on things and we will benefit. That's very true. Every year, it's like more and more gets found out. And a lot of times it's patients leading the charge, like our dear Kelly on the panel. He's one of our loudest voices, and he goes on Capitol Hill and he's making change happen, and we all are. I think we say this all the time too. Even just going out in public, wearing your compression garment visibly is an act of advocacy and normalizing what it looks like for people to be out wearing compression. And somebody might see you and it might give them a boost, and you never know who's watching you and who you're helping. So that's my spiel.
Thank you.
Thanks. You're welcome, Kelly. All right, everybody. Well, everybody's saying their goodbyes in the chat as well. And we're just so grateful, like we said, that you're here with us. Whether you come every month or pop in when you get a chance or catch the replays, we're just so glad you're here, and we love being here for you. So we hope to see you next month or catch us on the replay, and have a great great rest of your month, great rest of your evening. Hang in there. You're not alone. We're all here with you. And yeah, we just wish you all the best. Thanks for tuning in, everybody. And we'll see you soon. Bye, everyone.
Keep fighting.
Keep fighting.